Nurse practitioner is an advanced skills nurse that has a master's degree, and we can do advanced clinical assessment and prescribing. We can order pathology and imaging, just that extra level of clinical assessment.
It is quite diverse and you do see a multitude of things, so it's not predictable. Keeps you on your toes, keeps you thinking.
There's probably a greater responsibility and maybe autonomy with regional nurse practitioners. I'm being asked for my opinion on how things could change, how we could do things differently.
We're very committed to having them in our emergency departments, but also branching out of those traditional places. We've got nurse practitioners that work in mental health, that work in palliative care, that work in cancer services, that work in aged care.
My role is advanced nursing care skills to provide proper care to, people who have severe and enduring mental illness. Try and get the appropriate care to the person in a timely manner while they're waiting for that specialist medical care. So I normally work in the community, but I am also heavily involved in the clinical liaison team as well within the Geraldton Regional Hospital, and manage that team, the team of clinical nurse specialists.
My understanding is that the nurse practitioner role in the emergency department is to support the registered nurses and clinical nurses, give them some clinical leadership on site. The other part of my role is to reduce the impost on the emergency telehealth service and provide a timely service to the community.
I have extended skills and knowledge to look after cancer patients in particular, and that includes skills things like assessing patients, prescribing treatment, prescribing some diagnostic tests and medicines for patients, providing a point of contact and support for patients regarding symptom management and their treatment, so phone calls to patients to do some assessment over the phone.
With nursing background and with holistic nursing, you treat the patient and family as a whole. Not just treat their clinical condition, medical condition, you also address their psychosocial issues and then any emotional needs and practical issues. You try to help them a lot. And the nursing staff on the floor, they say, the patient has seen by the nurse practitioner before treatment, and they feel safe.
In my role, there's a lot of regional travelling. I support the multi-purpose sites across the Midwest. So I go to Carnarvon and Exmouth and Meekatharra and all the little sites in between, and we've got residential care patients in those facilities, so I try and oversee their care in regards to cognitive decline and physical decline, try and give them best care strategies and just make sure that they get to stay within their local communities.
I saw the limitations that I had as a clinical nurse, and I had an understanding of what the patient's needs were at the time, but I wasn't able to make the decisions or to enact that without the support of a doctor. It makes so much sense for my patients to have an opportunity to have more timely care if I had the skills to provide that for them, so I decided to sign up. Being in the country is no barrier to progressing your career and getting the qualifications that you need. I went to the local university here, so I was given a scholarship through WACS to complete my Masters as a nurse practitioner.
Workshops and things are now being provided online, which I think is very, very useful. I've got the support of my Regional Director of Nursing to fly or to go anywhere where I can get extra training. We
have a nurse practitioner network through WACS. Because a lot of the nurse practitioners in WACS, they're quite diverse in their area that they do work. Some are nursing posts, some are ED, some are a bit further afield and a bit more or less of a hospital kind of setting, just a health centre. So we do sort of catch up with the nurse practitioner network.
We've got real responsibility as a profession to invest in these staff and that model, and if anyone is interested in coming on board and working for Country Health in a nurse practitioner role, then they absolutely should be reaching out to us, because we have vacancies and we're always looking to strengthen our numbers in that space. 30% of nurse practitioners within Australia work in rural and remote settings. They lead the way in terms of providing best practice for clinical care, but clinical research and education and leadership, they're just so pivotal to the teams that they support.
You've got nothing to lose, it's all there, everything's available, the opportunities are available and the training is available.